Top of the morning, Dan and Amy. Here's what Dr. Tony Fauci had to say at the briefing yesterday, in which the three-phased guidelines for reopening were presented.
In fact, mitigation works. You saw the charts that the vice president and that Dr. Birx put up. It worked. And what we hope, and I believe we will be successful, if we carefully do this, again, with the attention to the safety and health of the American public, that we will be able to. It will be staggered. Not every state, not every region is going to do it at the same time. That's clearly obvious because of the varied dynamics of the outbreak. But we feel confident that sooner or later, we will get to the point, hopefully sooner, with safety as the most important thing, to a point where we can get back to some form of normality. The one thing I liked about it that Dr. Birx said so well is that no matter what phase you're in, there are certain fundamental things that we've done that are not like it was in September and October. You want to call it the new normal, you can call it whatever you want. But even if you are in phase 1, 2, 3, it's not okay, game over. It's not. It's going to be a way that we protect ourselves because, as we know, and as I've said from this podium, it may very well be, as we go the cycle around, that there'll be this virus that wants to come back to us. I think we're going to be able to handle that. Thank you.
And phase one of the three phases, which is where Illinois probably will be at some point.
Forever.
Maybe. Well, we still need, we got a long way to go to get to phase one. But phase one, designed to mitigate the risk of resurgence, as you heard Fauci describing, would allow public venues such as arenas, theaters, restaurants, places of worship to open under certain social distancing conditions.
Okay.
While suggesting that all vulnerable individuals should continue to shelter in place. That's the summary of it. And then it gets better as you move through the phases,
right?
Obviously.
And school's not opening until phase 2, correct?
That's the guideline, correct.
But you also have to reduce the number of cases within 14-day period, and you have to have the ability to treat patients without crisis care and testing for at-risk healthcare workers.
Yeah, Birx's phrase was each phase would be related to 14 days of decreasing evidence of illness. 14 days. So that's broader than just cases. I want to use her words and
Okay.
take them specifically, take them literally. Decreasing evidence of illness, that's broader. So it's just worth noting. And then, of course, these are guidelines promulgated by the Fed. So what constitutes the manifest weight of the evidence might vary from state to state. For more on this, we're pleased to be joined again by Dr. Robert Citronberg.
Yay.
He's an infectious disease specialist at Advocate Lutheran General in Park Ridge, Illinois. Dr. Citronberg, thanks for joining us again. Appreciate it.
Good morning.
Morning. Do you do the phases that were announced yesterday strike you as reasonable and appropriate?
Yes, I think they're reasonable. The problem is that we're drafting these as we go along, and they're subject to change. So I think it's important to have a plan, but also to understand that we can't be rigid about the plan. That as we get into it, it's very likely that things will change depending on how we're doing with the disease.
What do you mean? Like in what? How? Mean like we could have the hot spot flare up again or something, and then
yeah, exactly.
We'd have
so
to go back.
Exactly. Let's say, for example, we start to reopen some public venues, and then we see a spike in cases that was unexpected or unanticipated. Then we may have to backpedal a little bit to reinforce social distancing. So I think it's going to be let's say, trial and error, but we'll have to be very cautious about trying it and getting back out. And obviously the best scenario is that we will not have any spike in cases or resurgence in disease, but we have to be prepared for that and have backup plans in case that happens.
Some encouraging news on the therapeutics front, the remdesivir trials at University of Chicago, the funding that Moderna is receiving for the development of a vaccine, even some, again, anecdotal evidence about the effectiveness of HCQ, particularly with respect to some nursing home patients in Galveston County, Texas. How sanguine are you about at least the prospect of a therapeutic treatment for those who are infected before the summer is out?
I think there will be drug therapy that once we study it with science will be effective. The problem we've had so far is everyone's so desperate for a cure, and understandably, that many physicians are ordering drugs to treat these patients not in any sort of controlled clinical trial. And that's a problem because you can't gauge the effectiveness unless you have a controlled clinical trial. So as we get further into the clinical trials that are being done at places like University of Chicago, as you've mentioned, then we'll have a real idea of what the science is. And we are hopeful that one or more of these trials will show benefit from drugs, whether it's remdesivir, which is the Gilead drug, or other drugs. We don't know yet. There is some anecdotal evidence that hydroxychloroquine works in some patients. We just don't know which patients that is yet. Vaccines extremely important as well too. And in order really to effectively eradicate this epidemic, we're going to need two things. We're going to need drug therapy and vaccine therapy. That's really the only effective way to get rid of it. So I think in the next few months, we should have some information that will tell us which way we're going here. The vaccine takes a year to year and a half to develop, even under the best circumstances. So I think drug therapy is going to be more important earlier than vaccine therapy.
How is the caseload at Advocate Lutheran General Hospital? I mean, do you have enough ventilators? How many people are in your ICU? What's it like?
Yeah, I can speak across the whole healthcare system. It's probably easier. The whole healthcare system is the Advocate system is full. Now it varies a lot by region. So some areas are particularly harder hit than others, but we are running at high census for ICU type patients. The good news is because we've cut down on basically all elective procedures, we have a lot of beds available for patients that we wouldn't have had otherwise. And we've also have a lot of staff who have been reassigned to help take care of COVID patients, which is also extremely important too, so that we have extra bodies that we can use to take care of these very sick patients. So right now we're able to handle the load. The numbers most recently in Illinois are very encouraging in terms of flattening the curve. The whole idea of flattening that curve is to prevent the number of patients who need care from exceeding the capacity to take care of them. And right now, we're still okay. We have the capacity to take care of all the patients.
Do you think that Illinois should move into phase one at the beginning of the month?
Again, there's still a lot can happen between now and the end of the month. And what we're looking at are a couple of numbers. We're looking at obviously the rate of growth of the curve, that so-called flattening of the curve, which there's no doubt that has slowed down in the last week or 10 days. The number of new cases is about the same each day, but the rate of growth has slowed. The other thing that we look at is something called the doubling time, which is the amount of time it takes for the number of cases to double. When we first started in Illinois, it was about 2 to 3 days. The number of cases were doubling. Now it's about 12 days, which is a huge improvement. So if we can continue to lengthen that doubling time, then things will be more optimistic for the reopening of certain services probably come the first of the month. But again, it's going to be very dependent on what happens between now and then. A lot can happen. The curve is flattening, but it's not going down. And we really need to see that curve going down before we are really talking in all earnest about reopening services.
But there's going to be more cases because more people are getting tested, correct?
Oh, for sure. Yeah, that's part. There's definitely a bias in terms of testing. So the more you test, the more you can identify, and that is absolutely the case. One of the things that we're concerned about now is transmission in nursing home populations. In the last couple of weeks, we've seen a big uptick in nursing home populations where there's outbreaks, and unfortunately, these are some of the most vulnerable people that we have, and they tend not to do as well with this disease. So we are definitely keeping an eye on that. But you're correct that the numbers, and we knew the numbers were going to go up with expanded testing. So we're trying to separate that out as a variable and determine what's really happening in the community. It does seem like community-based transmission is decreasing, and that's largely due to social distancing. Social distancing works. It works from the first day you do it, but it takes a couple of weeks to see the results, and we are now reaping some of the benefits from that.
Well, speaking of the science with respect to transmission, a couple of studies this week, one out of Hong Kong that finds that there was almost no instance of transmission outdoors. They looked at north of 300 cases in a particular region that was impacted by the virus, and found that there was only one case where more than two people were infected. The great majority of cases, three infected or more, were in household settings, whether a family or people living together in close quarters, so they're the higher viral load. And then, in addition to that, a study out of the Institute of Virology and HIV Research at the University of Bonn finds, through looking at surveys across the Heinsberg region, where 1,400 confirmed cases have been reported in a population of about 250,000 inhabitants, 46 coronavirus-related deaths. No transmission of the virus in supermarkets, restaurants, or hairdressers. So what about I understand social distancing, but social distancing to the point that you can't go outside, you can't jog along the lakefront, you can't play golf, you can't play tennis, you can't go get your hair cut. Isn't there a viral load issue, too, that has sort of been underrepresented?
Sure, and that's the concept you're talking about is true with many respiratory viruses. Even the common cold, much more likely to be transmitted indoors than outdoors because it's a higher population density and less ventilation indoors. So that's a very valid point. In terms of doing things outside, you can always go outside, and that's never been part of the shelter-in-place. The shelter-in-place order has never said, nor should it say, that you can't go outside. It's just you have to keep your distance. And just understanding how the virus is transmitted helps us figure out how to get back in there. So, again, the vast majority of transmission of this virus is by the respiratory route, by droplets that travel about 6 feet, and then they drop to the ground. And so the primary and by far most likely way you get this virus is by being within 6 feet of somebody who has the virus and is either coughing or talking loudly, can expel the virus that way. You can also get it from surfaces too. Somebody coughs onto a surface, you touch it, and then you touch your face, so you can infect yourself. Probably a less common mechanism than the respiratory route. So anything you do socially, if you can keep your distance, if you can stay more than 6 feet away from someone, you're drastically reducing your chances of getting infected. So in terms of re-entering and things that you can do, certainly, people are dying to get their hair cut because no one's had a haircut in a month. And so is it safe to go into a hair salon? Probably, if you have social distancing, if the customer and the hairstylist are both wearing masks and taking appropriate precautions. But yeah, I think it's very reasonable. That's something that we can start to look at.
Good, because I'm starting to look like Dusty Hill from ZZ Top. Here's just one more thing, the maddening question on testing. So, again, this week, President Trump talked about Abbott Labs coming online with antibody tests. They're going to be 20 million produced, distributed, so on and so forth. I don't understand why it's taking so long, particularly because I personally talked to an employee at, for example, Chem Biodiagnostics out of Long Island, that says we have a antibody test, and actually it's an antibody test which will test you for the virus. It will also test the level of antibodies you've developed if you were infected and asymptomatic, for example. And she tells me that other companies, her competitors, have tests as well. There's a Rutgers test that was talked about earlier in the week, then the Abbott Labs. Why is it taking so long, and why can't we and shouldn't we have been on parallel tracks for this entire time to do representative sample testing on both for both infection as well as the antibody tests, so we can better model the incidence of infection, the incidence of asymptomatic individuals, the potential upside of infection that could continue, so that we can make better policy decisions about reopening and everything else?
Sure. I mean, you've hit the nail on the head. So we collectively, entire country got a very, very late start on testing. We weren't prepared for this pandemic in terms of testing. Other countries, even places like South Korea, they were testing 10,000 people a day from the very beginning. We were nowhere near that. And it wasn't until about a month or 5 weeks ago that the private labs and the private companies got the go-ahead to develop their own tests. And actually, it seems like it's taking forever to get these tests out. First of all, in the last month, our testing capability has gone up dramatically. We are now able to test almost everybody we need to test So we've actually improved. And I know it seems like a long time, but actually pretty much all of these tests are being approved under emergency use authorization by the FDA. So they're actually, it's a lot shorter time period than it normally is. So normally it takes several months at least to get these tests approved. They have to be validated. But every single test now is being pushed through under emergency use authorization. So the good news with that is that we get more tests out. The bad news is they haven't all been completely validated, so we don't know exactly how good all the tests are. It's certainly better to have tests than not, but we have to be a little bit cautious that we don't know all of the characteristics or the qualities of the individual tests. Now, with regard to the antibody testing that you're referring to, that could be a game changer in getting us back into society. So
Right.
The antibody test can do two things. One, it can tell you who has the disease right now. But more importantly, it can tell you who had the disease. And all these people who feel like they had a flu-like illness in the past month or two,
Yeah.
they may well have had COVID, and the antibody test will tell you that if you had it or not.
Well, where can we get one, or can we just go call our doctor and see if we can get an antibody test?
Yeah, it was just approved the week before last. It should be available in supplies in most labs, I think, in the next week or two. So, yes, that's something you would just get a doctor's order for, and you can get an antibody test. And so the importance of that is to do what we call seroprevalence studies. And what that means is you basically test as many people in the population as you can to get an idea of how many people have had it. We know that many, many people have this disease and never have any symptoms, and they can be identified by this antibody test as well. So then if you're talking about getting people back into the workplace, if they have a positive antibody test, it should be considerably safer for them to reenter society. We'll also have a much better idea of exactly how many people have had it. So I think that in terms of reentering society, I think the antibody test is the key.
What about bringing the mountain to Muhammad when it comes to that testing? And by that I mean have employers reopen and have serological testing of their employees. It's an easier way to get people to come to the test and do it through employers. Is that something that makes sense?
That makes perfect sense. I don't think there's the supplies yet to do that, but once there are, and I would expect in the next few weeks to a couple of months, we will have those supplies. That's a perfect idea. Additionally, I think that we're doing health screening at most businesses now, where you have your temperature taken when you walk into business, and that may become a permanent thing in our society. We may see health screening. It's been done in Asia ever since the SARS epidemic back in 2002, 2003. It's become a regular part of society there, and I think we may see that to a certain extent here as well. So when you enter your workplace, you can be certainly tested, but you may also be screened for any symptoms of respiratory infection. Because remember, once this particular pandemic dies down, it's not going to go away completely. Every indication is that this coronavirus will come back as part of what we call a seasonal virus, and so it will reemerge probably next winter, and we'll be much better prepared for it next winter than we were this winter for sure.
He is Dr. Robert Citronberg. He's an infectious disease specialist at Advocate Lutheran General Hospital in Park Ridge, Illinois. Dr. Citronberg, thanks so much for joining us. Appreciate it.
My pleasure.
It was great to have you on, and he joined us on our turnkey.pro answer line.
The stories you need to know to start your day. This is Chicago's Morning Answer on AM 560. The Answer.
This is Owen Strand for townhall.com. The coronavirus pandemic is awful. Nonetheless, we should not miss that this event allows us the opportunity to take stock of our national health. Here's one angle. For decades, Americans have watched as uncritical globalism has shipped hometown jobs to overseas locales. Many hardworking people have lost employment, with many men struggling greatly. Opioids have filled the gap, leaving families ravaged in their wake. Too long have we just watched these trends. Too long have our towns crumbled, our families pulled apart. Too long have we tolerated economic chaos to buy trinkets for a few dollars less. The social costs have been staggering. A global economy bears many benefits to us all, but uncritical globalism has had major consequences. We need masks, for example, but depend upon a corrupt Chinese government for them. The irony is thick. Now is a great time to imagine